Hi, everyone, and happy 50th Earth Day. We're so happy that you have taken an hour out of your day to join our second Health and Harmony webinar, during which we want to talk to you more about our planetary health response to the COVID pandemic. I'm Jonathan Jennings, the Executive Director of Health and Harmony, and we're so grateful that you're here. I especially want to sincerely thank the healthcare workers around the world who might be joining us this evening or this morning. We appreciate so much the risks you're taking and the work that you're doing on the front lines of this COVID response. And so once again, I'm raising my tea glass to you. I also want to thank any young people that might be online with us tonight. We badly want to hear your voices, and we encourage you to use the Q&A function to send us your comments and questions throughout the hour. And that goes for everyone. We want this to be more of a conversation as much as possible with this webinar format. So please send us your comments and your questions. Use the Q&A chat function or the Q&A question function that you'll find at the bottom of your screen. And then you can apparently even vote for the questions that you would like to see answered. We're now several weeks into the physical distancing, and I really hope that you and your loved ones are able to stay safe and healthy. We know that the pandemic is not affecting everyone equally, and our thoughts are with all of you, and especially if you've lost a loved one or if you're suffering loss in other severe ways. Every member of our Health and Harmony community is a partner in our planetary health work, and it's thanks to you really that our unique response to this pandemic is possible at all. Very few organizations, in fact, have the ability to have an emergency medical response and at the same time implement conservation programs that are designed to keep rainforests intact and to curb global heating and the climate crisis. And that's exactly what we're doing at Health and Harmony and with our partner ASRI, and it's what we're going to talk about tonight. According to research recently conducted by King's College London, the COVID-19 pandemic could push 500 million people worldwide into poverty unless urgent action is taken in countries worst affected by the virus and its economic fallout. Since 2007, a lot of you will know that Health and Harmony and ASRI have worked together to support the just transition of hundreds of former loggers and their family members into new livelihoods, such as organic farming and small business ownership. And now if these farms and these businesses collapse as a result of COVID, these former loggers may have no option but to return to logging rainforest in order to survive and provide for their families. So ASRI and Health and Harmony's work right now in Borneo and Madagascar is focused on two interdependent elements. The first one is our medical response, saving as many lives as we possibly can during the infectious disease outbreak. And the second element of our response is a conservation response to bolster the resilience of these communities, whose organic farms and whose small businesses could be perilously close to collapsing, and who could easily be forced back into logging the rainforest because of COVID's economic effects. Now, tonight, we're really fortunate and lucky and grateful to have experts from Health and Harmony and from ASRI here with us to answer a few questions of mine, but more importantly, to take your questions and comments. Now, for those of you who may be new to Health and Harmony, ASRI, or Alam Sehat Lestari, is an Indonesian nonprofit. ASRI is Health and Harmony's cornerstone partner in Indonesia. It was co-founded by Kinari, who you're about ready to meet if you haven't already met. And today, ASRI is 100% Indonesian owned and managed. And we're really grateful to be joined by two of ASRI's senior leaders tonight. We have Mahardika Putra, or Dika. Hi, Dika.
Hi.
And we have Dr. Alvi Muldani, or Dr. Alvi. Dr. Alvi is a general physician. Hi, Alvi.
Hi.
Dr. Alvi is a general physician. He's a graduate of the Faculty of Medicine at the University of Jenderal Ahmad Yani, Indonesia. He's ASRI's medical director and recently completed a clinical observership at Yale School of Medicine in internal medicine. Mahardika Putra, or as we know and love him, Dika, is a PhD candidate in forest genetics and conservation at the University of Copenhagen in Denmark. And before that, he earned a master's degree in forest genetics from Bogor Agricultural University in Indonesia and from the University of Zurich, Switzerland. and he is ASRI's Conservation Director. Hi, Dika.
Hi.
Kinari Webb is our fearless leader and founder. She is the founder of Health and Harmony and the co-founder of ASRI. And Ashley Emerson is our Health and Harmony Program Director, who comes to Health and Harmony after many, many years leading international programming across West Africa and in other parts of the world. Now, we very much want to hear our participants, hear from you, hear your questions and comments. You can send those using the Q&A tab at the bottom of your screen. And look, again, especially if you're a young person, if you have a question or comment, could you just include a capital Y, capital P with your question so that Trina, our managing director, hi Trina, will know to prioritize your question for the panelists. And with that, I would like to just jump into the questions and hear from all of you four. You are the true pioneers in planetary health, and I really appreciate your availability joining us from Indonesia tonight. Dr. Alvi, my first question is for you. ASRI's medical center services a catchment area of approximately 120,000 people. What has ASRI's medical team done to prepare for the pandemic? And what have been some of the greatest challenges and some of your early successes?
Okay, thank you, Jonathan, and I will try to answer your question. So in order to face the pandemic, we have prepared some steps, including modification of our patient flow and hiring related providers, and increasing the universal precaution, supplies, and a backup planning. So as I mentioned before, so we have prepared a special room for a patient who has a symptom with related symptom with COVID conditions such as coughing, sore throat, and shortness of breath. So the goal of making this system is to minimize the risk of transmission from patient to healthcare provider, or from a healthcare provider to patient, or from patient to patient. So in terms of change, I have mentioned that we have separated one room special for somebody who comes to the clinic with respiratory tract illnesses such as coughing, sore throat, and runny nose. And the other criteria for the patient that come to this special room is fever and having history of traveling to local transmission areas or having contact history with positive or confirmed case. They'll go to a special room called batuk pilek room. So batuk pilek is a phrase in Bahasa meaning cough and runny nose clinic. So using that term, we're hoping that people won't get scared to see our clinic, to come to our clinic to get a treatment. So in that room, we have assigned a doctor and a nurse who are in charge for the day and triage if the patient is a suspect or not. So there is always a challenge behind in this new system. Sometimes patients come to the clinic. They don't answer travel history with truth because they're afraid of stigmatization. So stigma scares people more than the disease itself in our community. So other thing that we have done as a preparedness for this pandemic, this COVID pandemic, is to provide standard personal precaution equipment for healthcare providers. So ASRI is concerned about our staff safety. We are trying to our best to provide our staff, especially our healthcare provider, with standardized universal precaution. So right now, everyone is wearing a gown, N95, head cover, face shield, and during service hours. So other than that, we facilitated our staff to wear scrub that we provided, and they are facilitated to take a shower at our clinic before going back home. By doing that, ensuring that they are safe and feeling safe and minimize the contamination that they could bring home. And knowing that nutrition and immune system could minimize the degree of the disease, we also provide a traditional spice drink, eggs and milk that we believe will boost our immune system. And we always implement hand hygiene and health etiquette. For the first time, challenge happened at the beginning. A national increase in demand for personal protective equipment led to skyrocketing price. But this time the price was getting stable, so money from donors really helped us during that difficult situation. And I would like to say thank for all the donors that donate their money. Other thing that we are thinking is to make a backup plan for the worst case scenario. So reflecting from the other country that has significant number of COVID-19 case, give us an insight of COVID case projection in Indonesia. Looking at our national case curve itself, it's growing exponentially. Locally, now we have 1 positive case in our region and 5 positive cases into our survey region. Given the fact that we might face a condition where the government hospital could not take COVID-19 patient anymore, we have a backup plan to provide care to suspect or confirmed patient. Even though we are still in preparation level right now, we have been in touch with MSF Indonesia, or as we know as Doctor Without Border, which has more experience in handling crisis situation like pandemic. We are working together on how to make protocol and system for COVID-19 preparedness. And we are doing hiring more healthcare provider as well in order to just in case if the confirmed case is arising or the suspected cases. So that's yeah.
Well, that's very impressive. From coordination with the health system to the preparedness of your facility and safety of your own staff to the preparation for case management. Thank you so much. And now, Dika and Dr. Alvi both, how are your communities feeling and how are they reacting? What's the level of their awareness of the existence of COVID-19?
So I will try to explain like ASRI has 2 spot of surfing, so which is in Sukadana and in BBBR. I will start with Sukadana first. So initially when the outbreak was announced and spreading around the world, but Indonesia, the community was not aware that this COVID outbreak was going to be spreading very rapidly and extensively, and the government has not started to make a plan for preparedness yet. But by the time we got our first suspected case, everyone was panicking, and the government started to make plans. So the governments made a task force for COVID with members from various entities and sectors. And the community here has been minimizing going out and preferring to stay in their home, which is good to minimize spreading, but it seems that they are scared of this pandemic condition. We can feel it by seeing a decreased number in our clinic visits. And the other thing that has risen after the first case is a very strong stigma to suspected case, so the suspected patient and healthcare provider to take care of them. Some people prefer to self-medicate if they catch a cold because they were afraid if they were identified as a suspected COVID patient by the doctor. So the thing that they are worried about is if they're identified as a suspected case, they will be avoided by the community and they become a top topic among the neighbors. So which happened to our first suspected case. And we believe there are unreported cases because they are afraid of the stigma. So because of the stigma, more and more people didn't report their self to a local health department. And since then, we have been maintaining a good communication with the local government. Stigma among our staff, especially healthcare provider, was very strong as well. So the community believed that our staff was exposed to suspected case because we don't know our patient that are taking care of, whether they carry a disease or not. And they are afraid of getting it from us. The stigma was affecting the whole aspect of life. For example, there is one story from our healthcare provider when when our staff's neighbor was angry at our staff's sons because he was playing in front of her house. And that happened in whole country, resulting extensive campaign and campaign about stigma and discrimination. So now the stigma and discrimination has been better, but it still happened.
Okay.
Yeah, thank you, John.
So you still feel like the stigma is something that you and your team have to be prepared to overcome or to deal with, even going forward?
Okay. That's true, Jonathan. But I think it's getting better because a lot of campaign over the country talking about stigmatization among healthcare provider and among suspected cases. So it's getting better, but we still have.
I keep telling the team that actually they're heroes, and that soon the community will feel that way about them as well.
Great, thanks, Dr. Alvi. Now, Dika, you're the conservation director of this planetary health program, and I think I just want to draw everybody's attention to this. Really, what fascinates me is that these two individuals are senior leaders of the organization, and they work hand in hand when it comes to the development of the organization's strategic plan. Dr. Alvi doesn't make his medical plans without Dika, and Dika doesn't make his conservation planning without Dr. Alvi. Dika, how's the conservation team doing? What are they doing? And specifically, what are you working on and why?
Yeah, so of course, I mean, due to this COVID-19, some of our work might have to delay, but we try our best to, keep going, because we know that protecting rainforests at this time is very crucial. And we continue our work even though we have to slow it down a little bit due to physical distancing, and also some of our staff, studying work from home. So, but we try our best to, continue our effort to help saving our beautiful rainforest. Some of the programs like reforestation work might be slow at the moment, but mainly due to the season. So we're entering the end of rainy seasons period, or wet seasons. Therefore, all planting activity is stopped, and we will continue our planting activity in the next wet season, which might happen in September or October this year. But we continue to care and growing seedlings in the nursery, increasing participations of our forest guardians and community in growing seedlings, as well as maintaining a relationship with national park, because we get most of our seedlings are coming actually from within the park. And we also continue receiving seedlings from patients as non-cash payment. And then we have a chainsaw buyback program. So just 2 days ago, we managed to collect 3 chainsaws from our inactive loggers. This is also one of the important thing during this time, because as the economic slow down, we afraid that many people will return to logging, and we need to maintain people's faith and commitment to not to return to logging. And we try our best possible to buy more chainsaws that still exist in the community. As for monitoring of illegal logging, we still carried out this program as well with the help of our forest guardians. So especially in a remote village where it's not possible for our monitoring staff to go to because of the limit, social distancing and travel restrictions. So we rely on the information that we get from forest guardian. And as the dry seasons is approaching, we also keep maintaining fire break, increasing fire patrol to combat wildfire cases that might happen. So there is no hectare of reforestation site lost to wildfire. So, and we're working closely with National Park to monitoring hotspot and taking precautions as needed. As for our replication site in BBBR, we have developed further collaborations with IAR, the International Animal Rescue, one of our partner, to come out with a plan on community development for our second site in BBBR. So we've been discussing a lot of possibility and opportunity of this partnership, and we think we're getting there. But due to this situations on the COVID-19, we restrict travel to BBBR because we also would like to ensure that the community there is safe. Also to point out about the COVID-19 situation in BBBR community, we send protection gear to our medical staff there so that they can equip themselves and then be ready should any cases arises. So I think
good.
that's...
Dika, can I just interrupt you and say that BBBR is Bukit 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 Raya National Park, which is ASRI's second program site, and IAR is International Animal Rescue, which is a world-renowned organization that you are partnered with at this site. I just wanted to clarify that for viewers who may not know. Good, fantastic. Thank you, Dika. Now, happy Earth Day, Trina. Do we have any questions or comments from the ether?
Happy Earth Day. Yes, we do. Our first question not only is from a young person, but was also upvoted by somebody else, and it is a great question. So they're wondering if the ways that ASRI has made healthcare more accessible, such as by using seedlings as currency and the healthcare discounts, has that allowed ASRI to cushion the economic impact of COVID-19?
Great question.
Alvi, do you want to answer that question? Do you want me to jump in? Up to you.
Please, please help me out to the question.
Okay, I'll start and you jump in, okay?
Okay.
So it really, that is, I would say, basically I would say that's one of our biggest concerns. First of all, we're very worried about the community's health. We're worried about our staff's health, and we want to make sure that the whole community is safe and healthy. But we're also really worried that with the economic stress, people will go back to logging. And so we are hoping that all of our programs together will really build resiliency in the community, and that that's not going to happen. And so we're watching it very carefully. And indeed, the fact that people can pay with seedlings means that they know that they can access care no matter what. And I think that that really does make people feel safer, and know that they'll be okay. And I'm also really happy that we're still able to care for the seedlings, and we'll be able to plant them at the end of the year as well. So that is super important. Yes.
Yeah, thank you for that question. Trina? Oh, sorry, Alvi, go ahead.
Okay. So other than that, we still receive a payment from a patient with seedling. So one of the biggest contributor for our seedling reserve is mobile clinic in Pangkalan Jingking. So in Pangkalan Jingking, we do mobile clinic once in every month. But because of the COVID situation, we are preventing to transmit disease just in case. So we didn't do that anymore. But in order to the alternative for that, we see our patient medical record in our clinic and see the patient who need a frequent, who need routine medication. So we send the medication to the mobile clinic site. Hence, they're still getting the treatment, and they still can pay the medication with it. So that keeps us getting seedling from the community in mobile.
Fantastic effort.
Yeah, and also we need seedlings, more seedlings for reforestation. So we're not going to stop, receiving seedling as non-cash payment.
Great question. Trina, more questions from participants?
Yeah, I think we've addressed this in some ways with the economic concerns, but another young person question is that apart from medical and healthcare related challenges, what other challenges are the communities facing during COVID-19?
So apart from medical healthcare related challenges, what challenges are you seeing your communities facing right now?
Dika, do you want to try to answer that one? Oh, you're on mute.
Uh-oh.
Do you want me to jump in?
Oh yeah, you can jump in first.
So one of the big questions one of the big problems that Alfie actually already addressed is this issue of stigma. So we are very, this is an issue for all the healthcare providers in the Regency and all of their families, but it's also exactly like Alfie was saying, like some people may even be afraid to get healthcare right now because they're afraid they might get diagnosed with COVID. And they're worried that how their neighbors will respond to them. So that's a big concern. Economic downturn is a big concern, especially for people who are living on the margins. When I was last there in the middle of March, already the price of a lot of goods was going up, and that was making it more difficult for like small store owners to be able to continue to buy their supplies. Has that, I can ask you, Dika and Alfie, has that stabilized now, or how is that going now?
Well, we received some report that some of the community difficult to sell their products, especially the chicken. A community who works for chicken farm, because usually during this time of the year, it will be a full month of fasting in Indonesia, and before that fasting month started, usually there's a celebrations. There's a lot of weddings, there's a lot of celebrations. So the price is usually rise up. But right now it is COVID-19, there aren't many things going on or happen. So the demand is really slow at the moment, and it really not a good business for a chicken farm. For chicken farm, as well as we live close to the sea, so we also have a beach right here, and those community who live next to the beach also relying on a lot of visitors. And since social distancing, stay at home campaign has been going on for weeks now, so there aren't many visitors that come to visit, and those community also quite vulnerable at the moment, find another way how to feed their family and then stay healthy and safe at the same time. So it's really, really tough.
So Ashley will probably want to jump in here and talk about this too, but Ashley and Dika together have designed basically a stimulus package for the community, and a real concern that people might go back to logging. Especially like we've helped many people start, sell their chainsaws to us and then start small businesses so that they don't have to log anymore. But those businesses could be very fragile through this time. So we've talked about actually having them grow seedlings during this economic stressful time. When they can't sell chickens, they can grow seedlings. We'll buy them from them. As Dika was saying, we need more seedlings. And that's kind of a way to get them through a rough time where they're still doing okay financially. We're also working with our farmers to also see what they need, and we may also be buying seedlings from some of them. And then our biggest concern is the folks who are these inactive loggers, and that they will go back to logging, right? So to try to buy their chainsaws and help them as well during this time. Ashley, did you want to add anything to that?
No, I think that sums it up really well. It's inspired by the fact that we know during a health crisis, communities that have access to a rainforest tend to turn to the rainforest as their greatest resource for quick liquidity. Whether it's in Indonesia around Gunung Palung or Bukit Raya logging, or in Madagascar extracting wood to create coal. that's their greatest resource. And so we've done lots and lots of research over the past 12 years to better understand this behavior. And so that's what we shaped this stimulus package around. And we measured it in a way that we could look at what the highest risk groups were that would be degrading the rainforest. And I would say the concept was also inspired by the fact that, on the other side of this pandemic, and even during it, we still have these grave challenges of the climate crisis. And so in an effort to continue to protect and preserve these rainforests, the really important work that Dr. Alvi and Dika are doing to reforest and support communities in that effort, we need to continue to address the climate crisis while this is going on and build the resilience of some of these communities who are oftentimes the most vulnerable. So
if anyone wants to donate to that program, we'd be super happy about that too.
Great, thanks everyone. So we've been really focusing on ASRI's catchment area and the Sukadana region and Bukit Baka, Bukit Raya. Now I'd like to zoom out with you, Kinari, and ask you a question about Dr. Monica Nirmala. 2 questions. I want you to briefly tell us who she is, and if you could talk about the advocacy work, the really critical advocacy work that she's able to do at Jakarta with the Ministry of Health and other ministries.
So Dr. Monica has been so crazily busy with helping all the COVID response at the national level that we weren't sure we could actually get her on this call, but she will be on our next webinar. But I think she is actually on the call right now. So Dr. Monica she's listening in right now. She is our previous executive director, and she, with our loving support, went to Harvard to do a master's program in public health. And just as she returned to Indonesia, the whole crisis began to hit. She wrote a blog post that went viral about the stresses that Indonesia was going to face in this. She then ended up on TV multiple times, and she's now been really very instrumental and in supporting many aspects of the government response. She was also just in Forbes magazine last week, promoting, expressing her concern about Mudik, which is the largest internal migration in the world that happens every year, where about 20 million people travel at the end of Ramadan to go spend time with their families, and often return to their ancestral villages, and everyone gathers there. So that was, as Monica put it in the article, a potential bomb, which is to say that if everyone went all over the country, already we're seeing coronavirus spread throughout the country, but if 20 million people traveled, it could be just an enormous spread and completely overwhelm the healthcare system. And then just a couple of days ago, the president actually came out and encouraged people to really, in fact, they say they're going to ban the travel during that time. So she's working on lots of different things. I have to say, I'm glad I'm not a leader of a country at this time. It would be incredibly difficult to make these hard decisions. And I also, if I was doing that, man, I'd sure want someone like Monica giving advice and being by my side, because she is amazing and she's doing a brilliant job. And we are delighted to have her there. So.
Yes. Cheers, Dr. Monica. We know you're out there listening. Trina, back to questions that you may be getting from our audience.
Yes, here's a great one from Dr. Jeff. He's wondering, he's talking about how his home state, New York, appears to start to be on the mend. But one of the things that they've seen there in New York is a lot of environmental justice challenges in certain communities. And so he's wondering if you've also observed differences in community patterns of either COVID infections or the impacts that different communities are having. I think, Dika, you talked a little bit about the communities that are living right on the beach, but are there other differences in how this is impacting different communities within Sukadana or at Bukit Baka, Bukit Raya?
do you need the question repeated, or?
Yeah.
Trina, can you just repeat?
Sure. So have you observed differences in communities' impacts of COVID between Sukadana and Bukit Raya?
Yeah, as for Bukit Raya, because we maintain we keep our contact with them during this time. So one of the things is that the community is more cautious and more worried that that these diseases will come into the community. Also because of one of the reasons is that the healthcare, apart from the healthcare that we deliver there in the community, it's quite far to reach, and there aren't many rapid kits tests that are available right now. So they're quite afraid that it might coming into their community. And just very recently they said for us not to send our staff there, if possible. They also said the same thing with our partner IR, not to send staff from Sukadana or from Pontianak. Even we have one staff he returned to Pontianak for family stuff, and then he actually not really banned, but the community encouraged him not to enter the village right now. So people are more cautious and more worried. But at the same time, we try also, how to educate them in the best possible way. I mean, sometimes it's difficult to understand the situations because they're dealing with a lot of other things as well. I mean, even before COVID-19, they've been dealing with TB, for example. TB disease. They suffer enough from a lot of different diseases. So maybe they can really cope, with the COVID situations. Kinari, would you like to?
Yeah, no, I think you answered it really well. So one of the ways that we're dealing with that problem at Bukit Raya, and to keep them safe, these are very, very isolated communities, and it's possible that we can actually keep COVID from going in, which would be amazing, right? But we're putting in satellite internet right now because we just know we have to be able to communicate with them really well. And if there are cases, we need to be able to help them work through them. And Dr. Alvi will be able to talk to our midwives, our doctor there, and really, guide them if should there be any cases. So that's our, that's been one of our biggest concerns right now, is protecting them and also communicating with them because they don't even have internet.
I would say one of the biggest transitions that ASRI made, probably about a year ago now, was they initially started with sending pretty impressive groups from ASRI, from the conservation team and the medical team, all the way out to Bukit Raya to provide these mobile clinics. Eventually they decided to just hire staff and place them within the community, essentially setting up an entire public health system within the 9 communities that they work. So that in itself has made a big difference. The doctor there's 2 midwives, there's a nurse, there's a conservation team. And so a lot of the infrastructure is there. So I think that was really helpful and, wise for us to consider as we move forward in other sites, this model.
Yeah.
Great. Well said. Thank you. Trina?
Yeah, so there's a question too about, for Dr. Alvi, the availability of COVID-19 test kits in Sukadana and in BBBR.
Okay. Thank you for the question. Do you mean the availability for us to access rapid test? So actually, rapid test is distributed by the government, so we can refer the patient who needs getting the test, who need the test to the government. So we have been maintaining good communication with local public health. So if we found somebody who is suspected for coronavirus, we usually call them directly by phone and then discuss together and considering what is the status of the patient will be. For example, in our national criteria for COVID-19 guideline, we have several status for our patients, such as people under supervision, people under investigation, or person without any symptom. So that's determine how are we going to manage the patient. So um, we need to certify the patient first, and then if we discuss together and we agree to do the test, the rapid test, we will do that. But the problem is the rapid test is not always available in the local government, the local Department of Health. So we have to contact the public health first. And that recently it's now more available. So they are trying to they're trying their best to fulfill the supply. Yeah.
But it should be noted overall that Indonesia has one of the lowest testing rates, certainly in Southeast Asia, and I think throughout the world. So that's something Monica's working really hard on the national level, is to really increase the testing and to increase the methodology for putting people in quarantine or in isolation, depending on their status. We really need more tests. I've been working hard on trying to figure out how to get them. It's not easy. And the rapid tests that Alfie's talking about are actually antibody tests, which then have to be backed up with a DNA test. And so then that result takes at least 10 days to get in Indonesia. So that's also really hard, especially when you're trying to figure out, like we have a case who's in isolation, has been there for almost a month, and we'd like to get him out, but it can take 10 days to get the test result that says he's now safe to leave. Right, so. Yeah.
But in addition to that, the good news is in our local, in province of West Kalimantan, we have already had PCR for that. Before, we have to send the specimen to Jakarta for PCR testing, for DNA testing. But now it's available in Pontianak, so it will cut the time. Yeah.
Good, I hadn't heard that. That's great.
Good news. So Trina, before we go back to your questions, I just want to make sure we have a chance to hear from Ashley, our program director, about our Health and Harmony response in Madagascar. So Ashley, if you could just give us an update on the situation you're seeing and then our team is seeing in Madagascar, and just what our response there is today.
Yeah, sure. So similar to what the medical teams and conservation teams have been doing in Indonesia, we have been doing in Madagascar. And so, really focusing on health outreach, preparation and response, doing as much as we can to, quell the spread of cases, but also working with our team, Dr. Evelyn, who's the medical coordinator, who's done lots of kind of national preparation and education and outreach throughout Madagascar. She's been leading the support for frontline workers, local administrative bodies, the Ministry of Health locally, and then working in the clinic posts. So there's about 30 small clinics around the region we work called Farafangana. And so she's been working with the staff and those clinic posts to help update them on everything from, how to properly wear a PPE, protective equipment, how to safely take a temperature, things like basic hand washing and sanitation and setting up hand washing stations. And then the hope is that they would then train community members, and they are that first line of response for the rural villagers who may have COVID and then need to be referred into the hospital in Farafangana. And she's working with them on the triage and referral protocols. So they're working really hard. They're doing a remarkable job. Victorienne, who oversees our conservation programs in Madagascar, is supporting her, and starting tomorrow, they're going out to work directly with the CSBs, these clinic posts, and the staff there to bring them supplies, conduct training, etc. The other thing that we are doing is similar to what's happening right now in Indonesia around Gunung Palung and Bukit Bukit Raya, is thinking about how do we advance conservation activities during a pandemic. What's fortunate is that we can continue to roll out these programs and support what the communities have asked for, because these things can be done at a safe physical distance. So in terms of what we're doing for conservation during the pandemic in Madagascar around Manumbu is really focusing on rice cultivation and agriculture. So again, these are major issues of, food security that will help some of the underlying issues of poverty and malnutrition. But again, really protecting this unique rainforest Manumbu Special Reserve. And also doing things like building fire breaks. So because of TAVI or slash and burn agriculture, fires can be a major impediment and issue, but building these fire breaks is a lot of work, but they can have a really impressive impact to stave off fires. We support the communities to do that through food for work programs, so supporting immediate kind of health and nutrition needs, but also, again, protecting their farms and the rainforest. And then, of course, doing reforestation work. So that's another activity that we'll be beginning, where we'll support the communities in cultivating seedlings and then supporting reforestation efforts. So this is part of the conservation plan during the pandemic, similar to what we'll be doing in Indonesia. We believe that during this time, we can continue to advance health and well-being of these communities and the rainforests that they steward and support.
Great, and thank you for drawing drawing a line under our not only desire, but the need we have to continue these conservation initiatives. Ultimately, for those of you that are new to Health and Harmony, we're a planetary health organization with the mission of reversing deforestation of tropical rainforests in order to curb global heating. Now, the very unique way that we do that means that we are a healthcare provider, a conservation specialist, and doing other work around livelihoods. So it's very, very important to our broader mission to both save lives and livelihoods today and continue to protect rainforest. Thank you, Ashley. Trina, we've got time for at least one more question, maybe two or three.
We have a lot more than one more. So, yeah.
Do you want to read a couple? Read a couple, and go ahead and read a couple questions, and we can all just jump in.
Sure. So we've got another one from a young person about the opportunities for mobilizing young people in Sukadana and around the world. So I think that's a great one. Dika and Dr. Alvi, I don't know if you want to answer that.
I think I'll try to answer that. We started a campaign for young people. I think about a week ago, we launched this program on, it's mostly social media campaign. So we encourage young people, but it reached out to not just in Sukadana, but at the moment it reached out to people in, young people in the region in West Kalimantan. So they will post, their activity, campaigning, stay home, and then social distancing with different topics every day. And then they have sort of like a mini challenge and a game as well. They will get a reward after. So there's a daily winner or something. And they did this throughout, social media platform. So it's started already for the campaign.
Great.
I would say internationally, very quickly, Ashley, if you want to mention the movement of our planetary health education curriculum online, if you wanted to give 25 seconds on that. I don't know if it's accessible yet for young people internationally.
It's not yet accessible, but there's about 120 people that travel to Sukadana every year. These are doctors, nurses, students, photographers, kind of anybody who's interested in learning from the experts at ASRI about planetary health. We have two major programs that they can travel on. One is more of a intellectual academic program, and the other one's a bit more practical. Obviously, because of COVID, we've closed that program down, but Noor, who oversees that, is transitioning that online with her team at ASRI. So we'll look forward to sharing more news about that in the coming weeks, but that will be a great way to learn about planetary health from the ASRI team in lieu of being able to travel there right now.
It'll even have virtual walkthroughs of all the different programs. So.
Yeah, fantastic. And I see Brian McAdoo online at Yale National University in Singapore. He has been spearheading some phenomenal work with his group of students, with ASRI teens and kids. So we're making these international connections and trying to spread the message about planetary health practice and theory. Okay, one more question, or from a young person or of your choice, Trina.
Okay, I
Maybe
think
two more.
This is this is a really good. If I can have two more. Here's a couple questions about one, the forest guardians. Dika, are the forest guardians been involved in educating and monitoring communities during COVID-19?
Yes, they are. And in fact, we trained them about 2 weeks ago. And Dr. Alvi gave a lot of insight on how to, deal with COVID-19 situations, and then how to educate people to practice social distancing, hand wash, washing their hands regularly, and the coughing etiquette, and that kind of things.
And from me too. So other than forest guardian, we also involve our DOTS worker. So DOTS worker is a person who watch closely to monitor patient to consume TB drugs. So they are also involved in that training. So other than forest guardian, also DOTS worker.
You can call them community health workers. Yeah,
community health worker. Yeah,
they are heavily also involved in that. And we're doing one other thing, which is very interesting. We've taken phone numbers from our patient database, and we're working on this to send out automatic text messages to the whole community, which will also educate people about COVID and about the forest and about the interrelationship and all that. Yeah.
Okay, Trina, one more quick one.
Great. Okay, this is a great last question about if we feel that we're seeing the connections between climate change and coronavirus that are increasing awareness of our interconnection with one another globally and with our planet. Kinari, you want to start with that, and other people can chime in?
I'm sorry, I actually saw a note from Monica and I was distracted. Tell me again.
Do you see a connection between climate change and the coronavirus that is increasing awareness of our interconnection with one another globally and with our planet?
Yes, I do. So the truth is that if we damage ecosystems, it damages human health. That can happen in many different ways. Viruses, which were perfectly happy and doing well in their natural ecosystems, can come out. We don't know exactly how coronavirus came into the world, but we do know that other viruses have definitely come from, they're called zoonoses. They come from the forest, and when they can spread, like, Ebola, HIV, all these are all MERS, SARS, these are all viruses that have the potential to really harm us. But what has an even bigger potential to harm us is climate change. without a healthy natural ecosystem, we can't have healthy humans. And vice versa. We've discovered that if people are not healthy and doing well, they are often driven to destroy their ecosystems when they don't want to. So at Health and Harmony, we look for planetary health. We look for a space where local communities are healthy and safe and thriving. The forest is safe and healthy and thriving, and the whole planet is healthier. And we've discovered that's possible.
Very well said. Thank you, Kinari. And in closing, I want to send an enormous thank you to Dika and Dr. Alvi and Monica. The three of you and your colleagues at ASRI are true pioneers in planetary health. You've been doing for 12 or 13 years now what we at Health and Harmony are trying to take to the rest of the world. But specifically, Dika and Dr. Alvi, thank you so much for taking time away from your extraordinarily busy days to be with us. And Kinari and Ashley and Trina, thank you so much for the amazing work you guys have been doing and for tonight. And then finally, to our supporters, our community of supporters, we can't do any of this without you. We can't make any of this impact on the lives of people and the integrity of rainforests without you. If you're not a supporter yet and you're just becoming acquainted with Health and Harmony and you would like to be a supporter, here's how you can help us save lives and protect rainforests right now. The first thing you can do is just continue being kind to one another. Stay focused on what behaviors we can change now for the sake of the planet. The second thing you can do for Health and Harmony is stay safe and healthy and engaged. There's a power in collective action for both coronavirus and for climate change. Third, you can donate to Health and Harmony. We're a nonprofit. We only do what we do. We're only able to do what we do thanks to your support. And you can right now contribute to our Health and Harmony Emergency Fund, which is doing everything that you just learned about, providing personal protective equipment for Dr. Alvi's teams. It's providing Dika's teams, his conservation teams, the ability to maintain the nurseries, care for the seedlings, and it's supporting Monica's work. Dr. Monica, the former executive director of ASRI, is doing some incredible advocacy at the center in Jakarta with the Ministry of Health and the President's office. And of course, our teams, medical teams in Madagascar. Your support will go directly to their COVID response as well. Fourth thing you can do is consider becoming a monthly Ironwood donor. Monthly income sustains us and it allows us to be versatile and innovative in our planetary health work at times like these. We have been able to react very rapidly with an emergency medical response and with what you might call an emergency conservation response as well. Thanks so much to everyone for joining us. We so much appreciate it. I want to leave you with some inspiring words by our friend and colleague Dika, who said recently, quote, "While this pandemic reminds us of the vulnerability faced by communities living around the world's rainforests, it is in the interests of us at all times to protect them and the forests they call home." Thank you, everyone, and good night. And to our friends in Indonesia, good morning. Cheers. Stay safe and join us next time. Thank you.
Thank you.
Thank you,
Thanks all.
Jonathan.
Take care.
Thank you all.
Thank you so much.
Bye.
Bye, guys.